Welcome to another mini lesson. We're still in the female reproductive system. This time we're going to talk about disorders of pregnancy and childbirth. Let's start with ectopic pregnancy. The term ectopic just means outside of its normal location. So you'll also see this term ectopic in other chapters like cardiovascular chapter when we talk about the normal pacemaker of the heart. But this time we're talking about pregnancy. So ectopic pregnancy just means a pregnancy that's not in its normal position. So normally, the fertilized egg should travel from the uterine tube and implant in the uterus. However, in an ectopic pregnancy, for whatever reason, the fertilized egg is prevented from moving from the uterine tube down into the uterus, and it will start to develop in that uterine tube. This is a very dangerous situation because there's no room for the blastocyst to grow, and eventually the uterine tube will rupture, which can endanger the life of the mother. And obviously, the embryo cannot develop. Disorders like salpingitis, endometriosis, and pelvic inflammatory disease, or PID, can lead to ectopic pregnancy. Preeclampsia is a disorder that involves increased blood pressure, proteinuria, and edema after the 20th week of pregnancy. It can also involve headaches, nausea, and visual problems for the mom. This needs to be closely monitored because if left uncontrolled or untreated, it can lead to a life-threatening condition of eclampsia. And no lie, in all my years of nursing, the sickest patient I ever took care of was a pregnant mom with eclampsia. In eclampsia, the mother will have seizures or convulsions, and if this occurs, there's a risk of oxygen deprivation to the fetus, which can result in fetal death. There's also a risk of death to the mother due to lack of oxygen to the brain. Uncontrolled preeclampsia, or the first sign of eclampsia, requires hospital admission and control of the mother's blood pressure. The baby will be delivered as soon as the mother is stable, regardless of how far along the pregnancy is. Another disorder that is related but not mentioned in your book is referred to as HELP syndrome. The acronym HELP stands for hemolysis, elevated liver enzymes, and low platelets. HELP syndrome affects about 15% of pregnant women with severe preeclampsia or eclampsia. Amniotic fluid abnormalities usually occur in the second trimester. Amniotic fluid travels through the fetal respiratory and gastrointestinal tract and promotes the development of the respiratory and GI organs. The first abnormality is oligohydramnios. It looks like an intimidating word, but you really just need to break it down. Amnios refers to the amnion or the amniotic fluid. Hydro refers to water, and oligo is the prefix that means too little or a scant amount. So in this condition, there's too little amniotic fluid. Complications of oligohydramnios include increased chance of miscarriage, compression of fetal organs that can lead to suffocation, premature delivery, poor fetal growth, cord compression, and cerebral palsy. The second amniotic fluid abnormality that can occur is polyhydramnios, which simply means too much amniotic fluid. The prefix poly means too much or too many. Besides causing abdominal discomfort and breathing difficulties for the mother, it can be associated with preterm contractions and possibly preterm labor. It can also be associated with premature rupture of the membranes, rupture of the placenta from the uterine wall, abnormal position of the fetus, and postpartum hemorrhage. The cause of both of these amniotic fluid problems is not known. Gestational diabetes is a type of diabetes that only occurs in pregnant women. For some reason, the amount of insulin produced decreases, which leads to an increased blood sugar. They are also at increased risk for preeclampsia. During gestational diabetes, the mother's blood sugar increases, which means the amount of glucose sent to the baby also increases, and the babies tend to be larger because they gain more fat during growth and development. Mother and baby are both at risk for developing type 2 diabetes and obesity later in life. Hyperemesis gravidarum is something I am unfortunately very familiar with. Sometimes we just call it hyperem. About 80% of all pregnant women experience some degree of what we call morning sickness or nausea and vomiting associated with pregnancy, which usually resolves around the second trimester. However, in a small percentage of women, this nausea and vomiting is severe and can persist for the duration of the pregnancy, to the point where they become dehydrated and lose weight and require IV fluids and medication to control it. The next term is teratogenesis, which refers to the production of fetal abnormalities due to the mother's exposure to substances that cause birth defects. The root word terato comes from the Latin for monster, and genesis means formation or creation of. And the Substances that cause these defects are called teratogens. There are several medications that are known teratogens. For example, thalidomide is known to cause limb deformities and is no longer on the market in the US. There's several substances like radiation, chemical agents, things like that, that are known teratogens that should be avoided at all costs by pregnant women. Okay, so here's some more word analysis, words to compare and contrast. Neonatal and perinatal. The word nate refers to birth. The prefix neo means new, so neonatal we use to refer to the newborn or the first 30 days after birth. The prefix peri means around, so perinatal simply means around the time of birth. And usually this is the week before, maybe the week after childbirth, but there's no definite time period for this. It's just around the time of birth. The next set of words we just did, oligohydramnios and polyhydramnios. And the difference here is the prefixes. So oligo means few or scant, and poly means many. So oligohydramnios, too little amniotic fluid. Polyhydramnios means too much amniotic fluid. Okay, so let's now look at disorders of childbirth. During childbirth, the mother and the fetus may be monitored using internal and external devices. These monitors will look for fetal distress, which may be due to lack of oxygen. This is an uncommon complication of labor and can cause serious injury if it's not recognized and treated. The position of the fetus is an important consideration during delivery. The normal position of the baby should be head down or head first, which is called a vertex presentation. Abnormal positions include breech, where the buttocks are presenting first. And breech can be either complete breech, what we call a frank breech, where the feet are up near the face, or footling breech, where one foot comes down before the other. In a face presentation, the baby's face presents first instead of the top of the head. And in a shoulder presentation, the baby's shoulder and upper back present first instead of the top of the baby's head. Nuchal cord is a scary condition where the umbilical cord is wrapped around the baby's neck during delivery. The obvious problem here is that the cord may become compressed during labor contractions and cut off the baby's oxygen supply. So this must be handled very carefully. Nuchal cord occurs in about 20% of all deliveries. In a prolapsed umbilical cord, the umbilical cord protrudes through the uterus before the baby, and pressure on the cord can cut off the baby's blood supply during contractions and delivery. So care must be taken to keep the pressure off the cord while delivering the baby. Premature rupture of membranes occurs when the amniotic sac ruptures before the baby is ready to be delivered, and this can cause loss of amniotic fluid and increases the risk of infection of the uterus and of the fetus. In some cases, the baby may need to be delivered prematurely. So we use this term premature. Gestation, we said, is about 40 weeks. And if a neonate or newborn, neonate is a term we give for a newborn up to 30 days. If the newborn is born less than 37 weeks gestation, we say they are born prematurely. Babies who are born before 28 weeks are considered extremely premature or preterm. The earlier a baby is born, the less likely he or she is to survive, and those who do survive often have serious and sometimes long-term health problems or disabilities. You may have heard the term micropreemie, which refers to a baby born weighing under 1 pound 12 ounces or before 26 weeks gestation. These teeny tiny babies are born months before their due dates and face long hospitalizations in neonatal intensive care units. The biggest problem premature babies face is underdevelopment of their lungs and respiratory distress syndrome, or RDS. Because the breathing center in their brains are underdeveloped, they often have periods of apnea or no breathing, and they're susceptible to bleeding in the brain and infections because of their undeveloped immune systems. Infants delivered after 42 weeks gestation are considered post-mature, and we refer to this as a post-mature delivery. These infants can appear emaciated, they may have meconium staining, their hair and nails may appear longer, and their skin can look dry and peeling. They can have creases on the soles of their feet, and they may have limited vernix and lanugo. Remember, the vernix caseosa was that cheesy protective covering of the skin, and the lanugo was the soft downy hair that covered and protected the skin of the fetus. The baby can suffer from meconium aspiration syndrome. Meconium is the very first stool or bowel movement that the fetus passes, and if it passes before birth in the amniotic fluid, the baby can take a large breath or gasp, and aspirate it into the lungs where it can cause injury to the lungs. All right, let's talk about some possible placental disorders. Placenta abruptio, or abruptio placenta, or sometimes called placental abruption, occurs when the placenta pulls away from the wall of the uterus before delivery of the baby. This cuts off the oxygen supply to the baby, and fetal distress will occur very quickly. This is a true obstetrical emergency and requires C-section to deliver the baby as soon as possible. Placenta previa occurs when the placenta is positioned over the cervical opening. This is usually not a problem during normal pregnancy. However, once labor starts, the placenta would separate from the uterine wall once the cervix starts to dilate and efface. Therefore, the placenta previa almost always indicates the need for a cesarean section. Retained placenta is the name for a placenta that remains during the third stage of labor, when normally the placenta is expelled from the uterus naturally. I think we talked about this briefly in a previous video. The result of a retained placenta is heavy uterine bleeding called postpartum hemorrhage, or PPH. Manual removal of the retained placenta may be necessary and may require the mom to go to the operating room. So we're going to combine the diagnostic and therapeutic procedures into this video since there's only a few in this section of the test. Prenatal screening tests are really important during pregnancy to determine if the baby is at high risk for special problems, and these tests don't diagnose problems, they only determine whether or not they're more likely. There's no risk of miscarriage from these tests, but it is important to determine if there's a risk for a problem, so follow-up can be done if it's needed. Chorionic villus sampling, or CVS, uses ultrasound guidance to place a needle in the abdomen or a catheter through the cervix to obtain a sample of tissue from the placenta that can be tested for fetal chromosomal abnormality. This test can be done earlier than amniocentesis, which we'll talk about in a minute. Ultrasound is the safest way to show most of the organs and bones of the baby while it is in the uterus. It is frequently done to show detailed pictures of the baby's anatomy, its size, and its growth. It carries no known risks, and it is the most frequently used method of prenatal screening. Amniocentesis is a diagnostic test that uses ultrasound guidance to insert a thin needle through the abdominal wall and into the amniotic sac to remove a small amount of amniotic fluid. The fluid is then sent to the lab for analysis to test for abnormalities. The test is usually done to diagnose chromosomal abnormalities and neural tube defects. And here are some abbreviations for this section of the text. GDM is gestational diabetes mellitus. LMP stands for last menstrual period. This is how we calculate a woman's gestation after a positive pregnancy test. MAS was the meconium aspiration syndrome. PROM stands for premature rupture of membranes. PPH was postpartum hemorrhage. RDS was respiratory distress syndrome. And CVS was chorionic villus sampling. All right, folks, that's it for this one. I thank you again for your attention, and I look forward to seeing you in the next video. Thanks.